The goal for a drive-up COVID test site is to properly screen and identify patients while minimizing the risk of cross-transmission of COVID to patients and staff. Although drive-through testing with NP swabs may seem easier and more efficient, we know that the challenges of reaching in the car with the left hand and the typical inaccurate technique of the swab not getting to the back of the nose results in lower sensitivities in our screening process. The drive-up technique described here uses nasopharyngeal aspiration, which gives the ideal specimen to minimize false negative results. It is important that staff be trained for no-touch interaction and process and proper distancing protocols. Identification of clean areas and potential dirty areas is mandatory. In this protocol, patients are screened appropriately by phone and given drive-up appointment times and verbal instructions. Patients are asked to provide a mask, scarf, or other covering over their mouth and nose for their visit. In this scenario, 3 parking spots have been designated for drive-up with appointment times 5 to 7 minutes apart. Transferable signs have been used in this concept with the 3 parking spots. At patient's designated appointment time, they are instructed to pull into the parking space designated as "Arrive here" or "In the hole." There are 2 other adjacent cars designated by transferable signs stating "On deck" and "Testing." With proper PPE, the verification staff member will approach the on-deck car and greet and verify the patient's mask and gloves. With the window cracked, the patient will be asked to display their ID and insurance card that is electronically linked directly into the EMR. The staff member dedicated for car interaction then signals to the patient in the testing car space to exit their car and approach the testing table. For this protocol, we will be using a nasopharyngeal aspirate rather than a swab to improve the sensitivities. We will be using what is called NPak, a nasopharyngeal aspiration kit. The testing patient is then asked to approach the low-level testing table and cross their hands over their chest and lie in a supine position with their mouth and nose covered. The mask or covering is pulled down to expose the nose, but the mouth is still covered to catch any potential cough or sneeze during the process for specimen collection. A nasopharyngeal aspirate is obtained on the patient's most open nostril. The patient's head is extended with chin up and the catheter inserted to the verified depth with a quick installation and withdrawal of the aspirate. The syringe is capped and the aspirate catheter is disposed of in the proper receptacle for contaminated materials. The lab runner confirms labels in the paperwork and verifies the name on the labels with the patient. The patient is asked if there's any further questions and verifies post-test instructions. The capped pre-labeled specimen syringe is then placed in a specimen bag held open by the lab runner with no contact technique. The staff member dedicated for car interaction will then move the 3 transferable signs as the test patient leaves. The arrival car will now become the new on-deck car, and the on-deck car will now be the tested patient. Of course, there can be other variations of this protocol, including addition of specimen collection such as sputum collection that can be added to the specimen of a nasopharyngeal aspirate. This may actually improve the viral load of the specimen and should be based on recommendations of COVID specimen sensitivity data. Other modifications of drive-up or drive-through setups could be applied, and certainly attention to PPE modification and specimen handling should be dependent on individual facility recommendations. This serves as a sample protocol for drive-up nasopharyngeal aspiration to improve your testing sensitivity and ultimately to improve your patient outcomes, patient comfort, and staff and patient safety compared to other protocols.